Hello, everyone, and welcome to today's webinar, Provider Data Integrity and Governance. What, why, how, who, and best practices. Thank you for joining us. I am Lisa Allen, President of the Michigan Association of Medical Staff Services, and I will be the moderator for today's program. Today's webinar is being sponsored by the Michigan Association of Medical Staff Services and hosted by the Hardenbergh Group. Before we begin today's program, I'd like to share a few housekeeping details. All attendees' microphones have been muted for this presentation. To ask the presenter a question, click on the Q&A icon located on the navigation bar at the bottom of your screen and type in your question. You will also see a chat icon, which can be used to submit comments during the presentation. As time permits, at the end of the program, I will read the submitted question and ask our presenter to respond. Your NAMS approved CE certificate, along with the slide deck, will be emailed to you within 48 hours directly from Hardenbergh in your thank you for attending follow-up email. Also included in the email will be the slides from today's presentation and a link to a short survey. We hope you take a few minutes to share your feedback. Now, it is my pleasure to introduce today's presenter, Delicia Dimberg. Delicia is the Director of Professional Services at the Hardenbergh Group. She brings over 20 years experience in the areas of medical staff, bylaws, peer review, credentialing, privileging, and provider enrollment. She has established CME programs and has extensive experience developing multidisciplinary, system-wide provider data governance programs. Delicia has a BA in Healthcare Administration, an executive certificate in diversity, equity, and inclusion, and is completing her master's degree in organizational management. And now I'd like to turn it over to Delicia.
Thank you, Lisa. And thank you everyone for attending today's webinar. We're excited to have everyone participate. Before we get started on today's session, I just kind of want to share a little bit of how I got into this space of provider data integrity and governance. I originally transitioned into medical staff services as a medical staff quality analyst. And even before data was available, we were still using green screens, and we needed data, we needed information. And many of us worked with, like many of you, I'm sure, worked with paper files and had patient files and provider files piled on our desks and combed through to get information we needed for OPPEs and FPPEs. And as I graduated through the medical staff services profession, my roles changed, but my need for reliable and accurate information only increased. And as a leader in medical staff services, I needed information on productivity, how we were doing, timelines with applications. And senior leaders would come and ask for information on, demographics of the medical staff, and again, timelines, financial information that was impacted by the information in our database, in our credentialing software. So what we're going to share today are best practices that have been developed by applying basic academic principles of change management and data management, and a practical approach applying those to different medical staff services departments and organizations that this has been effective with, and trial and error and things that have been developed over several years. And so I'm excited to share that with you today, and let's dive in. So today's learning objectives, I think you've all shared and seen. This is an understanding of the foundational elements of provider data integrity and why without it, your data loses value and effectiveness. Identify how to manage and maintain that data, and develop processes and best practices to maintain that data and to govern the data. Sorry about that, we're losing our screen here. So look, basics. What is data integrity? What are we talking about when we say data integrity and governance? When we're talking about data integrity, we're talking about the information that's maintained in our source of truth. So our credentialing software. We're talking about information that is about our provider, that's maintained accurately and consistently, and that's highly reliable, and this has high quality data, high quality information. When we're talking about governance, we're talking about the collaboration of all the teams that rely on that data and that information in our source of truth to maintain their book of business, to manage their processes. So together, these two functions are really interdependent and also inclusive, because so many departments are relying on this information. And when we're talking about high quality data, this is what we're talking about. These are the top 10 characteristics that we've consistently seen in high quality data. Of course, accuracy. Some of these seem pretty simple, but when we say accurate, of course we want accurate information, right? We don't want information that's not appropriate, that doesn't align with what the provider has. But when we're talking about accurate information, are we ensuring that that information is accurate? Are we ensuring that it's accessible? And when we say accessible, are we thinking, should that information be available to everyone and anyone who wants it? No, we're not saying that. We're saying, is this information available to those who need it and the information that they need to manage their business? So all of these little pieces build together and result in high quality information. Inclusive, are all of the teams that rely on this information part of the building of the information? Do they have a say? Do they have accountability for this information? So you're also wanting to make sure that that's part of it. And is it granular? Is this information telling the provider's story and all of the provider's experience within the organization? So is it telling that picture from beginning to end of your provider's journey through your organization and within your software? So why should this be important? I keep losing my screen there. Sorry about that. So why should this information be important to your organization? There's multiple reasons. And when we're talking about this, we can't help but talk about how much money is spent in managing information. These are some pretty big numbers. $39 billion is spent annually. Of that $39 billion, $2.1 billion is on healthcare administration managing data alone. So that's a significant amount of information and a significant amount of finances that are dedicated in the healthcare industry to managing data. And so many different opportunities, like CMS has been managing that audit of the provider data integrity, right? Well, what they've determined over the last few years is that 45 to 55% of provider directories have been inaccurate. We're talking about simple information such as providers' business addresses, even provider specialties. They were inaccurate. So if our source of truth doesn't contain this accurate information, those numbers, those 45, 55% inaccurate data, that's going to continue. And that should be pretty important to us. We can't talk about provider data integrity and why it's important without talking about how it impacts the bottom line. So high quality data supports all of these things. Absolutely, value-based care. We're looking at our reimbursements, and this is critical for all of us in the industry. In addition to that, we have to talk about how this reduces write-offs. Having accurate information timely accurate information can really support an organization, ensuring that their billing is appropriate, reliable provider directory as we've shared, and really importantly, it connects patients to providers. So patients rely on our front-facing software, right? They rely on our front-facing websites to say who's available, are they accepting new patients, are they enrolled in different payers with different insurance companies. And so this is really critical. And it impacts the bottom line to any organization and to our providers as well. But if that's still not enough reason, let's talk about compliance. No Surprises Act. It's not a surprise to anyone. They have been auditing provider directories since 2015. And as you saw in that previous slide, 45 to 55% of provider directories have been inaccurate. But now there's an incentive to make sure they are accurate, because we are being impacted financially, as physicians are and healthcare organizations are, to ensure that this information is accurate. And this information should come from our source of truth. It should be current, it should be constant. And what else does this do? Well, No Surprises Act has all of these wonderful requirements now that, surprise, we have to come up with. So if you haven't even considered this yet, if you haven't even started having these conversations, this is something you can do today, right now. Start having those conversations. How are we going to meet this compliance? Are we looking at our information? Can we meet this compliance? Can we provide changes every 90 days? Can we say definitively where a provider's enrolled, that their information is accurate? And if the information has been changed, can we speak to that? We want to do this because if we don't, our organizations can bear the financial responsibility of inaccurate information. So this is pretty important for us to consider. And this is pretty valuable to have provider data that is accurate and reliable in order to meet compliance with this. In addition to that, we have multiple other reasons that provider data supports. And these are just some of them. So let's talk about a couple of these. So I can remember a day when we had to bring binders full of the provider's privileges, and we would drop off a current binder in all the clinical departments so that the clinicians would know what the provider was board approved to do. When you have a great, reliable system in your source of truth, someone can log in and look it up. You've saved FTE hours from copying and bringing things into a binder and delivering them to everyone. These are it's concurrent information. If there's a change in the provider's privileges, if there's a change in the address, that is concurrent, and someone can log into the system and see that accurate information. When we're looking at that, that tells us, okay, I can see a provider's photo. I can say this provider is clear and safe to treat our patients, and all of that information is there. Another great opportunity for having reliable information is higher level. As a leader, I was frequently asked for information on providers. So for example, hey, can you tell us what the age range is for providers in, let's say, cardiology? Well, they're looking at the organization as a whole is looking, we're going to need more cardiology services. The community as a whole has heart problems. We want to make sure that we can meet that need. But we don't know whether or not we're going to need to recruit, whether or not our providers are currently in the system and are going to be practicing for a significant amount of time. So they relied on our department to get in there, pull that information. Let's look at how long they've been practicing. Let's look at the age of our providers. And that information helps an organization make strategic planning, set goals, and know that the information they're receiving, that they're going to make their decisions on, is reliable and it's accurate. And this impacts your community. So that's really important. Another valuable piece that you use for data integrity. Now, a lot of people, maybe some on here today, are using spreadsheets. Maybe some of you are using the computer software and the source of truth. If you are, there's some great opportunities for using automation. Whichever credentialing software you're using, there's some amazing tools built into these softwares where it transitions med staff professionals from having to send out faxes and emails, and some of us are still having to use snail mail for whatever reason. We may not have the resources, and it takes so long to get processes done, right? You're waiting for that verification to come down, and okay, well, we have to put the committee off. We haven't quite gotten everything back. When you have great data, you can reliably automate your processes and know that when you set up your automation, it's going to go out. And when I say by automation, I mean, like maybe one day we would go into the OIG website and run the verification, ensure the provider's clear. Well, you can do that straight through your software. Provider's name is accurate in your system. The provider's social security number is accurate, birth date, whatever information that's a unique identifier is used through all of these different automated websites is in the system, and you can trigger that through your system. So it's another great reason to have this built in appropriately and look at it to ensure it's accurate. That's a lot of information, right? This is so much information coming in and it looks chaotic. So we're saying reliable, structured, and it meets all the characteristics, and it's going to go through and it's magically going to give us what we need. Well, sometimes it's, I still don't know. Maybe I want to stick to my sheet. Maybe I want to, I have too many files to work on, and this is too much to work on to make sure that my data is accurate. Well, let's talk about some other reasons. If the compliance didn't assure you, if the finances didn't assure you on why this is important, let's talk about some other opportunities to consider why you might need this. So routinely as a director, I was asked for information and they needed that information quickly. And I can't be the only one out there, right? That happens to all of us. Everybody needs it now. And so many of these questions consistently came up from myself and many of my peers as well. So ask yourself some of these questions and say, okay, can I really provide an accurate information on whether or not my providers are all enrolled at a glance? I don't know if someone else on the other team is asking for the same information. Is the provider providing the same information 3 times? Maybe they are. I'm asking for it in the CVO. I'm asking for it in the MSO. I'm asking for it in the enrollment team. So the provider is being inundated with all these questions. Is the information I'm gathering, is it valuable? Is it robust? Is it driving other processes like FPPE and OPPE? Well, if my answer is definitively, I can't say definitively yes to any of these questions, it may be an opportunity for me to start thinking about my provider data. And there's so many other processes. I'm going to give you some examples. All of these processes that I have at one point, and many of my peers have as well, done manually, right? And once you get a reliable system, you can abstract this information, and processes that used to take us weeks and days to do, we can get done in a couple of hours, in a couple of minutes now. So for example, the CMS attestations. Every year, my organization would get a request. We need this, we need to know when the providers assigned their CMS acknowledgement or attestation, whatever terminology you use. And we need to know who is admitting, who was approved, that has admitting privileges, all of those documents together and scan them. Oh, we've got to get all of those wonderful links together, and we've got to get the dates together, and we put that out there, and oh, it's taken us a few weeks now because we have several hundred providers who were appointed. Well, now, once you build that into the system, you can abstract that information and it can take you minutes to pull that. So that's pretty important. You get that in there, all of a sudden my FTE time that was spent weeks putting that together, it's wonderful. I have it all here. We talked about MPDB reporting. Let's talk about that. We have to meet criteria, right, to report issues with providers that meet that reporting criteria. And sometimes you may be involved as a MSP, you may be involved in that quality process and you're in the know. You know when someone's under investigation. And then there are times in certain organizations where you don't know. You're not part of the peer review process, but you do get reports from quality or risk or compliance. Well, when you ensure that you have a little piece of data in there to say, okay, well, this team is going to let us know the providers are under investigation. It's not part of our wheelhouse. We don't need that, but maybe we put a field into our system that's a checkbox, right? And says the provider's under investigation. Don't send out those affiliation responses, or if the provider resigns, I know because that little box is checked and I do whatever internal process I need to manage so I can ensure I'm meeting compliance with NPDB. Another one of my favorite processes, and this is probably one I've utilized the most, is implementation of new software. You've all heard that saying, garbage in, garbage out. When you're setting up a new software or even maintaining a current new software, the most important part is to have some clean data, or you're going to be putting data in. So I've seen organizations start this process and they don't clean up the data on the way. So when they start this new software, processes aren't going to work, automation isn't working. Oh, now they have to go back and clean up. At the same time, they're learning new software. So taking the time to abstract information and look at your data and making sure that it's clean is really going to help when you're implementing new software or when you're using different tools within a software that maybe you haven't thought of using before. So it's really beneficial to take that time to look at your data and look at this abstract information. So now one thing you look at all of these areas. This is not all done by just one team. Not all these processes are maintained by the CVO or the MSO or enrollment. It takes quite a few team members to talking to one another to get this done. So when we're talking about this, are we just talking about MSOs or CVOs? No, let's talk about everyone who should be part of this process. So all of these different teams, all of these areas are areas which intersect in data and rely on data to manage their business, to manage their processes and procedures. So when we're talking about provider data and provider data governance, we're talking about inclusivity of all of these teams. Now, should all of that information be available to everyone? No, that's not what we're saying. What we are saying is to ensure that you're all communicating and all of these areas, all of these different departments are talking to one another and identifying what each one of them needs in order to manage their business. Which elements of that provider information do we need in order to move forward and be effective and functional? So one of the key things I consider when you're talking about your provider data, and when you're even today, right now, I haven't talked about provider data. This is one way you can start. When you can start today is saying, who needs the information from our system? Start asking yourself these questions. And every organization is different. Every makeup is different. These are some examples of different team members who may rely on provider data within your organization. And the days of people working in silos, right? Oh, no, this is our software. We manage it. No one else gets to say what goes in. You know, those days are gone. Inclusivity and collaboration is key to be successful with this. So many different teams rely on the information. So it's really important to work together and identify the stakeholders within your organization, whoever they may be, who has to access your information, who has to rely on that information, and you build your processes together. So great, you've talked about, oh, what do we do? All of these people together. Now, where do we go from here? You start all of these conversations. How do we move forward constructively and effectively to save and identify all the different things that each team needs? Well, let's talk about that. Let's talk a little bit about how you can build best practices for your organization, things that you can do today and things that you can do for sustainability down the road. So these are simple, everyday things that we can do. Simple things that you can do every day, and you're halfway there. This is halfway part of the process. So when I say develop designations, I'm saying identify who's going to do it. Identify when things are going to be done and why it's being done. So often we forget to answer the why. Why do we need the start date in that particular field? Well, maybe we need to have a start date in this field because IS is pulling from that, and they need to know how far in advance they need to have a provider set up. Maybe human resources needs that date because that's when they start paying the provider to come in for orientation. Maybe that start date is going to help the CVO process the application in a timely manner to ensure that the provider can meet that start date. So identify from the beginning where all these little details of information are being collected and how it's going to be used. Aim for transparency. Again, I don't mean all the information open to everyone, but take the time to ensure that your records are clear and understandable, and that you're secure, that you're securing that information, but also that people understand why you're doing it, why this information can't be shared, why this information must be shared. And that's really important. Synchronicity. This is this is a big word. But what it means is that everyone is doing things parallel, real time, that you're not waiting to do tomorrow, what you can do right now. And so I know, for example, I know that when I go into the system, if I want to see what the current state of a provider's license is, I know that it's going to be accurate. I know that when I do a verification of a provider's license, I know the most current, the most relevant is right there for me to view. And we can all expect that and rely on it. So take the time to build that into your processes and ensure that all of your times and your processes align with one another, and you all have that same expectation that you're meeting it. And accuracy, of course, again, we want accurate information, right? We're not going to rely on errors and know, oh, well, you know what, I have to keep a spreadsheet on the side. I know we're using this software, but maybe I have to keep a spreadsheet because I can't rely on it. Well, rather than maintaining the software and putting your energy into maintaining this spreadsheet, I should say, and because I can't rely on the software, take that energy that you're putting into maintaining these two processes, a spreadsheet, and focus on why you can't rely on your software, right? Why is the information not accurate? And build that and develop those processes. So, for example, we're going to be talking about validation, one of my favorite tools for success in maintaining data. And you have to look at the why. If is there consistently information missing? Is there consistently information that's inaccurate? Let's take a look at that and see why that's happening. It's an opportunity for education. Maybe we need to develop a process. Maybe we need to develop a standard operating procedure, and take some time to look at that. So just doing these simple things every day, identifying all of these opportunities can really help. Okay, let's say you've got all of this information coming in. Information is pouring in from everywhere, right? What do we do with it? How do I know today that all of the information coming in from enrollment is going to be there, all of the information coming in from the MSOs is going to be there? My favorite part, validate, validate, validate. If you come away with nothing else from today's session, I'm going to recommend you do this. Something you can do right now. Every software that you use has built-in canned reports. Explore them. Explore your software and say, oh, what reports do they have? Some of them have little titles that say missing DEA, missing license. Take a look at those reports. Try to play with them a little bit. Think of, every organization might need a little bit more, maybe one or two more fields. So give you an example of this. So frequently, whatever your process is, let's say you have, maybe within 3 days of every board approval, everyone on the team has all of their data caught up. After that, regularly, every month, I am going to run a report to ensure that all the addresses are entered, all the MPIs, all of their licenses, all their expirables, et cetera. I'm going to run a report. Maybe I'm using a report that's already built into my system. Maybe I need to add some fields. Maybe the report doesn't include their specialty, and our credentialists each work on a different specialty, so it helps us know. I'm going to throw a specialty into the report. I might run this report and look for opportunities. Oh, that's not legible. Oh, that's not clear. Oh, that one's missing. And that helps you identify those opportunities. Oh, maybe someone needs a little education. Maybe as soon as I find it, we're going to fix it. Maybe I'm assigning someone on the team to do that. Maybe I've identified a trend. Every month I've been running these, and every month consistently there's the same missing information. So I might develop an action plan and say, how are we going to address this? And I can bring all of those great teams together that we talked about, all of those key stakeholders. Maybe people are complaining that the start date isn't in the system. Maybe people are complaining that, oh, consistently the privileges the providers requesting aren't there. So you can build reports to have a high level overview of timelines, of missing information, all of those wonderful processes that we go through, all of the points and the automation that goes through. And that really helps us identify opportunities for improvement and for ensuring that information is consistently looked at for performance improvement and meeting our goal of having accuracy and reliability. So if you're not validating, start there. That's a great starting point. Even if you're not able to bring teams together yet and you don't want to start talking about that, start validating your information. It's something that you can do today. I'm doing this once a week, maybe I'm doing it once a month, but what about the other teams? What else can I do to create structure and have sustainable process improvement with maintaining this data? Data governance. Now, I can hear groans when I say, yes, I'm talking about a committee. And but let's talk about why this is valuable, because I know I've been there and I felt the pain. We don't want another committee, but this committee is an action committee. And so this is where you're going to come together and you're going to talk about actually what you're doing, how you can do it better, what needs are being met, what needs aren't being met, and how you can meet in the middle to be successful. So data governance, you're going to bring all those stakeholders we talked about together. Develop a charter, identify your purpose of coming together. When you do come together, make sure you know why you're coming together. Identify things that you need to discuss now and things that maybe need to discuss in the future at a later date. This is higher priority. And develop a plan. And your plan should mirror what you hope to achieve, what you hope to accomplish in best practices, and how you're going to maintain those best practices. So governance, again, is that team coming together and establishing that rapport and building those relationships in order to be effective and successful in managing your data. When you have your meetings, oh gosh, you know, we've all been there, been to a meeting, and you think that could have been an email, right? We've all been there. But when you're talking data governance, ensure that you're coming together and your time is valuable and that everyone is heard. So in your structure, you build your agendas, but reach out to your team members and say, hey, are you having any issues with that data? Maybe you don't know when the provider's supposed to get set up in the computer. Maybe you don't know when the provider is going to be coming for orientation. That's an issue for you. You can't manage your business. Let's get that on the agenda. Let's talk about it. Let's build some goals and some processes and procedures. I can tell you often, in a couple of organizations in particular, and I'm going to share a story where it wasn't successful. And one of the things we had identified was we needed to build a governance plan. In the governance plan, we built it through our meetings. Consistently, people weren't meeting deliverables. They couldn't identify what they were going to do for downtime procedures. They couldn't identify what key elements they needed from the software, or they could, or everyone was really busy, too busy. One of the opportunities that we had there where this institution wasn't successful, we didn't have senior leader involvement. So when you're building these meetings, I also recommend that you have some senior leader input. Someone who's going to say, okay, we're not meeting deliverables. This is what we're going to do. This is a voice of reason, and maybe someone who has more sway in holding people accountable for meeting the deliverables and everything that you you want to accomplish. So do include that in your meeting, and I really think that that'll support you to be successful. So structure, you know, we talked about building that charter. We're going to talk about all of those little elements a little bit more. So not just, okay, here's what we're getting, why we're coming together. This is what we're going to do and why we're going to do it. But you really want to talk about the engagement and what everyone's role and responsibility is that is going to be part of your governance. So for example, you can say, if you have a CDO, the CDO will be the main player in accountability for most of the data in the system. Or you could say, if you're an MSS, the MSS will be responsible for ensuring that. Or you can identify this person's role, compliance or legal, is going to be part of your team. And legal's role in this responsibility and responsibility for this governance is going to be, they're going to ensure that, that confidentiality is being kept, that compliance with regulatory guidelines in how long you need to maintain your records is being considered, that they're going to be the final say and say, oh, that team really shouldn't have access to that information. This one should, in order to maintain compliance with state mandates, maybe peer review mandates. So really break it down and look at all the different opportunities that you have for all of these different areas as you're building your charter and your structure. And your provider data governance plan and policy, all of these different areas, purpose, definition, acknowledgement, key elements. And we're going to go into each of these a little bit more. I will have a handout that we're going to be sharing when we share the slides. That's going to include all of the best practices that we're going to talk about and a few more, because we can't put all of the best practices into one session. So we will be sharing that. And then some examples of a plan and all of these different elements broken out quite a bit more. So again, we talked about purpose in your charter, and let's talk about definition. How many different ways have you heard people talk about a provider? The provider, it's a physician, it's an APP, it's an APC. Everyone has different teams, have different words, but they mean the same thing. So when you build your plan through your meetings, through your governance, make sure you're all speaking the same language and identify words that maybe are interchangeable and have that same language built. We're going to get into a few more of those words and talk about that, and acknowledgement as well. So everyone wants a perfect system, right? But you need to identify as an organization what's good enough for us. Now, I'm not saying lower the bar, but identify what's good enough for you, what is possible with the resources that you have, with the system that you have, with the skill set that you have. And if you want to increase that, increase your knowledge, look at maybe next year's budget, maybe we can ask for something else. I know budget words, those are kind of, iffy, right? But take a look at that and identify those areas for yourself. And then key elements, and you'll see this in the handout. I broke out a sample for us. Every team should have the same key elements broken down to explain them. And let's talk a little bit more about each of these areas. So when I'm talking about definitions, these are just some general. The word good enough, what does that mean for our organization? We talked about that. Make sure that it's realistic expectations as well, not just, oh, we don't want to do it, so we're just going to say this is good enough. Immediate relief. What do I mean by immediate relief? So I know how many of us, we get so bombarded with work. Well, the provider just sent an email explanation of maybe something that was questionable in the credentialing application. I've gotten really busy. I have to get this done. I have to get this out. I have to answer this call. And the days gone by, I've forgotten about that email. Don't put off for tomorrow what you can do today. It's an old adage, right? We've all heard it. So immediate relief means when you receive things, when things come across your desk, get it into your system then. Don't put it off. Make it happen now. That way you don't lose those great opportunities and forget about things that were really important that should be in our system to tell that wonderful, detailed, granular detail story of the provider's experience. Data exchange. When you're building your governance, you want to talk about what information you need to exchange with your team members in order for them to do their business. And make sure you put that into your plan. Include those little details. It's really great to know, hey, if I'm going to change my process, I want to know who I'm going to impact. Oh, I need to contact marketing and let them know we need to change our process. So maybe data that they've been abstracting is no longer going to be available, or it's going to be found somewhere else, so that we don't trip up other departments and maybe cause a gap in their processes that could have unknown impact to us. So these are just some great opportunities for defining. We're talking about acknowledgement. We talked about identifying who's doing what on your charter, right? So identify within your credentialing software as you build your plan, who owns what pieces of each set of information. So let's say information that's going to be put on your provider directory is owned by marketing. You know, the quality department's going to own, oh, I don't know, information that's coming in from the OPP and FP. Maybe that's a far reach because so many organizations use different softwares for that. And you can see here some examples of different departments and how they may, depending on your own institution, of course, how it may feed that and support you. So just some examples of what you can do. These are some other best practices. Again, this will be included in the handout, so I'm not going to go into detail because there's so many. But ensuring access is considered before you give people access, not after the fact and saying, oh, they have too much access, let's take it away. Before you give access to someone, build this practice of identifying what access they need to manage their business, not giving them more access than they need and not giving them insufficient access than they need. So do consider that. And of course, work with maintaining your confidentiality. A good practice for imaging is to ensure that everyone has the same expectation and understanding of the quality of the image that's going to be built into your system. We've all been there. We've opened up a file electronically and maybe seen an image that you can't even read it, or you've seen an image that's kittywampus, you know, it's all crooked and you can't identify that. So we don't want to sit in front of a surveyor and bring an image up and it's not legible, right? So you do want to take some time and consider that. We talked about immediate relief and we talked about data exchange. Survey readiness, of course, you can use this now. We're not bringing these paper files in front of surveyors. You can bring up your screen and share it. Depending on whether or not the surveyor's coming in or not, and downtime procedures. The EMR has this, right? You should have this too for your software. Consider this. If your system goes down, people aren't going to just go home. You can still keep things moving. You can develop this into your plan, what each team is going to do to keep the business flowing. And not only that, when the system is down, what are we going to do and how are we going to get the information updated when the system comes back up? So ensure that you're looking at this for your data management and your governance as well. Now we talked about those key elements for each team. Each of these different areas are just great opportunities for us to break down by team where they cross-sect each of these areas. I have an example of this on that handout. I think I used the medical staff services as an example of how how they have to address access, what their workflows are within the system, what information they need to exchange, et cetera. So all of these details are in there for you to consider. So with everything we talked about today, where do you start? Where do I start right now? This was a lot of information. I have to pull all these committees together, to pull all these people together. Take it one step at a time. Start with validate, validate, validate. That was the one important thing I suggested, was that you get in there and you look at your information. Take a look at the quality of your data you have in there now. Brainstorm with your different teams and say, what do you think we should be looking at? Have you been seeing a consistent opportunity for information that's been missing? Start having those conversations with your peers. Talk about data governance. And also, when you've gotten this together, make the most and make the time to optimize the software that you have. Let the software do the work for you. That's a great opportunity for us. So in summary, we've talked about what provider data integrity and governance is. We've talked about why we need it, who should be a part of it, and how to maintain it. If still, any questions that you have after this, we welcome you to send those questions in if you haven't put the questions into the Q&A, and we really look forward to hearing from you. And thank you so much for attending today. And we're open to questions.
Thank you, Delicia. We do have a few questions. The first one, I think you answered, maybe even the first two. Would you have a template for developing an audit process for data integrity? And a plan that would be followed and reviewed for opportunities of improvement?
I do have the plan, and I'm excited to share that with you, and we'll be sending that out with the slides. When for data integrity, you mean like a validate type of report. I know many of the reports in the systems are built in, and they will include the provider's last name, the department, their specialty, maybe, and depending on what type of report it's looking for, it may be looking for, let's say, the license date that was put in, the actual license number and the license state. You could start there. Start with a report simple, just for the expirables that are maintained in the system. Maybe it'll give you a nice date range for providers who were appointed in February. Let's say we're looking at last month's data to make sure all of our team members got their information in, and you can start looking there. So start really simple. Start by, adding little fields to your report that are meaningful to you. You just don't want to start running reports and say, okay, it's fine, everything's in there. Find opportunities that are meaningful to you. Ask questions that we all know, right? We all know we've gotten a lot of calls, the provider's address has been wrong, or the provider's NPI has been missing. Enrollment can't start their processes because the NPI hasn't been verified, it hasn't been in there. Think of the questions that you get all the time. Hey, can you give me the status of this? What's happened with that? That's missing. Think about what's meaningful for your organization and start looking for those ways that you can pull that information out of your system and work with your software companies. You have some amazing software companies. Your organization spends a lot of money on these wonderful tools and resources. Reach out and see if it's not available. Maybe I need to learn how to abstract that information, and you can be successful that way.
Okay, thank you. Would you consider presenting a companion webinar to this one where you focus on how health plans and CVOs can address, this is a great one, address NCQA system control expectations? And I will tell you, I am struggling with this.
Yeah, I would consider that. I think that would be super. If that's helpful, we will definitely consider that. Thank you for that suggestion.
Okay, from my experience, there is always a turf war as to what department has oversight of the data. I've worked at organizations where revenue cycle is responsible and PE is responsible. What do you recommend for a large health system?
I think that's one of the biggest things. So we talk about project management, right? And everyone has these wonderful tools that they use for project management. And, we use a Gantt chart, we use this. No, a lot of people don't recognize, though, is the biggest piece of managing projects and things like this are the people element, right? That human element. And that's where the basic principles of change management come in. And we consider what can we do to manage all the fears that I'm not going to have control, or this one has too much control, or you know what, I've been doing this for years. They're not going to give me what I want. I know I'm going to get in there and there's going to be a wall, right? So there are other opportunities to be able to address those. And the people element is huge. And then also one of the suggestions I made before of having a senior leader present and who is a model of what you're trying to accomplish and the behavior you're trying to instill in all the team members as you're talking change, as you're talking development, that's pretty valuable and important as well, because they can help you in that aspect. And if it's a senior leader asking that question, I would say, start looking at the basic principles of change management to be able to support you to accomplish what you're trying to accomplish.
Okay, thank you. Let's see. This is a great idea and helpful tips, and I know my organization can benefit from this. I am not in a leadership position, and my opinion is rarely listened to. How do you suggest I handle this?
We can all do something every day, even if you're not the one running reports. And if you're in you can continue to bring, if you're an organization that isn't doing this right now and you're not leadership, start bringing those ideas forward. Have those discussions. Come with curiosity, come with, your interest and desire to communicate and be inclusive and maybe identify or fix a problem that's already out there. And if you can't do that, start with yourself. What can I do to ensure that my information is there? Maybe I can run reports. Maybe I can do something in my process to ensure that all of my data elements are in there. Maybe I'm the one working a credentialing file. And after I finish a file, when I know, let's say I'm a CBO, I want to take that file after I've released them, before I release them, hopefully, to the different facilities. I'm going to do a spot check. I am going to check all the fields that I'm responsible for, and also ensure that maybe I didn't miss something. Maybe the provider was doing an automated application and they might have missed a data entry and I didn't catch it. Guess what? I'm going to catch it now. And just start with what you're doing and try to be consistent with what you can. Absent of that, have those discussions. It's not going to hurt, right? Just bring a question forward with curiosity and a natural desire to just want to make things better.
Okay, the next one. Are there specific systems that you recommend that work really well?
There are so many great softwares out there. There's just great products out there. And I really think it depends on your organization and, what your organization, what meets the needs of your organization, what you're currently using, what you're hoping to accomplish, the skill set of your team. There are so many great softwares out there, but I would say that you really have to look at your current, plan and structure and, have some conversations and look at them all and see which one, explore what's out there and see which one meets your needs individually. It's different for everyone.
Okay, this one goes back to the NCQA system controls. Do you have any thoughts about the new NCQA system controls requirements and ways that can be used or integrated into a data integrity charter? Or maybe how it can be used as a tool for auditing?
Yes, that's the question of the day, isn't it? It's definitely a lot more complex and a lot more detailed. And I don't know if I want to say complex, because I think it also depends on the system you're using. But I think there are fundamental elements that can be used regardless of what system you're using and built, and would probably result in another hour session to go into the details. Definitely going to give some thought on how we can support you in answering those questions more in depth.
How do you validate information with the No Surprise Act to ensure that doctors' information is updated?
So different, I'll give you one example of how you might be able to do that. So let's say you have to let's say you're using the automated system and you have a report of like the provider's addresses. You can also include a field, or if it's automated, if you're in an electronic system, you can include a field that would put, this is the date the information was changed, right? And whatever team is relying on that can abstract that information. They can continuously, however they manage their system, pull that information to say, this is when the information was changed. Maybe they get a report. Maybe your marketing team gets a report anytime there's a change in an address. And it includes the date of when that information was changed. You know, that's really effective and supportive. Again, I think it's really important to communicate and develop that within your organization based on your current setup, your structure, and your current resources. It's really important.
Thank you. What is most important aspect with data when going from paper to paperless?
That, you know, I think that's actually preferable. You know, if you've never used a process before, let's say you're brand new, maybe you're still in paper and you're brand new to credentialing software, I think that's one of the best because you can ensure that you're getting accurate data, right? You can start off clean, and that's a clean slate. If you're transitioning from paper to paperless, which is probably one of the functions I've done the most, aside from software optimization and implementation, I would suggest you put as much information from that paper in there. So, for example, maybe the provider has been on staff for 20 years. Those first primary source verifications, take the time and scan those initials in there. Put those details on the history of how many times they've been reappointed. So you don't have to go back in a survey and pull the paper file and present the electronic file. I would say take the time to enter information into your system when you're going paperless. That's valuable. So don't spend time on scanning and uploading information that is really not going to have value to your process and to your systems. But give it some forethought and don't make those decisions in a silo. Include your senior leaders, include your physician leaders in those conversations, because you know this may be information that's valuable to them in the future. So don't just plan for what we need to know today. Plan for your future self and what you may need to know in the future.
Okay. What do you do when health plans ask for reports and they ask for different information in different template reports?
Yeah, that takes time. You know, we know those health plans, that takes so much time to build those individualized reports. I would say ensure that you're mapping. So sometimes, like, for example, a company will say, this is our template, we want you to use it. So when you have really great data, you can map your fields to those templates and ensure that you're giving them exactly what they want. So that's just one way of doing that.
Okay, so I have one more question left. What is the best way to determine who gets the data? How do you start to determine that?
That's an excellent question. You know, this is another reason why that plan works. Having a written governance plan, you're identifying, I need these fields. Maybe someone is asking for, okay, let's say your enrollment team is wanting access to the NPDB. And you've repeatedly said, we can't share that. You know, it's not something that can be used for enrollment. What are you going to do about it? You're going back and forth. You talk about it in your governance meeting. You have all of those appropriate stakeholders that can speak to the why. Bring up the regulations, share it. You're all on the same team. Why not have those frank discussions? And then you have legal counsel there. You have a senior leader present. And they can say, you know what, that information cannot be used in what you're thinking of doing with it. Ask questions. Why do you think you need that for your process? What value does it have to your process? So I think if you ask questions from the beginning and be curious about it, because I don't think people start off with malintent. I think people genuinely want to do a great job, and they just want access to information. So ask a question. Why is that important to you? And start those conversations in that way.
Okay. Thank you for the terrific presentation, Delicia. Many comments in the chat, how much people have enjoyed this. So we thank you. Thank everyone for attending. Please remember that your NAMS approved CE certificate and slide deck will be emailed to you by this Friday. Thank you for joining. Have a good afternoon.
Thank you, everyone.
Bye now.